Australia is among the most heavily vaccinated countries against the coronavirus, and it has decided to roll out yet another dose of the booster shots. It would be Australia's fifth such expansion. All citizens aged 18 and above who have not contracted coronavirus or been vaccinated in the past 6 months can take the jab. And this means about 14 million people, more than half the country's population, will be offered the Omicron variant-specific vaccines. Only severely immunocompromised people have been advised to take the fifth shot, and they can get it 3 months after their fourth shot. But the question arises, is Australia overdoing it? Because just how much is too much in this case? You see, 95% of Australians above 16 have taken 2 vaccine doses, and this has kept the COVID-19 infections in Australia under check. The country has recorded lesser COVID-19 cases as opposed to the other developed economies. But the uptake of the booster doses has been relatively slow. Around 72% have had a third dose, while only 44% got a fourth one. And this is one clear indicator of the declining interest. Australia's health ministry says the fifth shot will help deal with the next COVID-19 wave in the country, which it predicts would emerge this year itself. And the government has also made the fourth dose eligible for all aged between 18 and 29. Earlier, it was available only for people above 30 and immunocompromised individuals. It seems Australia is preparing also a lot harder for the worst. In India as well, adults can take a heterologous booster after the 2 mandatory vaccine doses. There is no official comment on a second precautionary dose. Experts are still pushing for it. But just how necessary are these boosters? And more importantly, how effective are they? America's Food and Drug Administration is tackling this very question. Americans have already had enough of the frequent COVID-19 shots, but the FDA has still proposed annual jabs. These vaccines would target the latest variants of the coronavirus. Now, this approach is similar to the yearly flu shots in the US. But you see, the experts are divided over the matter. They have their own apprehensions because even though COVID-19 fatigue has settled in, the virus is still very new. You see, COVID-19 spread has often been erratic. Unlike the flu, which flourishes in the winter months, the virus has consistently mutated into new variants. It hasn't settled into a predictable seasonal pattern, apart from the observation that it gets worse around December. So when its spreading pattern is not like the flu, why should the prevention measures be? Why should the preventive measures be? The virus may mutate multiple times a year. It could become more virulent and immune evasive, or it may not. And the frequency of the booster jabs should largely depend on that. On a population level, increased coronavirus vaccine coverage spells good news. But a major downside is that there is no one-size-fits-all solution. The protection offered by the booster wanes well before a year, and immunity against the infection may start declining within a few months. People at high risk for severe outcomes might need booster jab more often. But on the other hand, most children and healthy adults who have been exposed to the coronavirus are unlikely to become severely ill. So an annual booster or a new one every few months is probably unnecessary for them. Shouldn't countries like Australia consider these factors? Just when will this cycle of endless vaccine jabs stop? We also have to weigh in the economic factors because every time you get a jab, companies make money. Pfizer earned $37.8 billion through vaccination sales in 2022. Moderna made $18.4 billion. At the end of the day, booster doses are becoming a money-making machine, is what's very likely at this point. WION now available in your country. Download the app now. Get all the news on the move.